everybody. I'm very pleased to present a key opinion leader in wound management, Dr. Roger Schechter. Dr. Roger, would you like to present yourself, please?
Okay, thank you, Dr. Rahmo. Yes, I've been a wound management physician for about 21 years, and as a result, I have become interested in the diseases of aging because most of my patients are older and have a significant burden of chronic disease, and I like to say that wound management is the poster child for chronic disease management because most of the reason that people are non-healing are because of their underlying conditions, which accumulate as they age.
Yeah.
And I've become even more interested in aging because I've been doing this for 21 years, and so I'm getting old myself.
Aren't we all getting old? Yeah, I think this is something I would like certainly to elaborate at, the issue of aging. What do you think is contributing to the aging, and are those single factor or multiple factors that are in play? From your observation on patients, did you make an opinion on that?
Yes, I believe that for one thing, some people age at a different pace than others. I often take care of people my own age who, by my perception, appear to be 20 years older, especially given their burden of chronic disease. Of course, lifestyle contributes to acceleration of the aging process. In addition, genetics have something to play in this, but also there are other factors, including the inevitable loss of the potential for regeneration that's found in aging tissues.
Yeah, so do you think based on those many complex factors there is hope that you can, that in the future one could reverse that trend and regain some of these useful features by playing it smart? How would you approach this problem?
Well, it's sort of two-pronged. Number one, you can likely slow the aging process by paying attention to proper health behaviors, avoidance of smoking, avoidance of alcohol and recreational drugs. Beyond that, nutrition is, I think, very important, both in terms of consumption and absorption of adequate calories and adequate protein, and replacement of the inevitable loss of vitamins and micronutrients, which occur more rapidly in the aging population. That plus exercise, appropriate intake of water can make a big difference in slowing the process, but none of these can actually reverse the process. I think that the only way to reverse the aging process is through cell therapy.
I see. So, yeah, that's quite a strong observation that despite all this advancement in science, in medicine, we had improved the health conditions of many patients. Still, however, the lifespan did not really change much for human beings. So do we miss something fundamental here about the lifespan or about the aging process?
I think so. I mean, we have improved lifespan somewhat, but the question is really, have we improved health span, which is a slightly different concept. Lifespan is how many years you're alive. Health span is how many years you're healthy. And I believe that both lifespan and health span can be influenced somehow by manipulation of people's cells, utilizing cell therapy, specifically utilizing stem cells.
Okay. So yeah, we know from scientific reports that there is a steady decline in the amount of stem cells that is proportional to aging, and that is definitely an indication that there is a strong correlation between the two factors. So do you think that replenishing these cells could actually reverse or at least slow the aging process?
Well, I think replenishing the cells clearly can be beneficial and at minimum regenerative, and may not just slow the aging process, but in certain circumstances could reverse some of the effects of aging, especially on organ systems. The only issue with that is how do you deliver stem cells that are usually found in solid organs within the circulation to target organ systems that you wish to influence and create some type of regenerative effect.
But I mean, it looks like you have a strong conviction about that. So where did you, how did you make that strong conviction regarding reversal of aging as a wound healing specialist?
Well, we actually use living placental mesenchymal stem cells currently in wound management. I've seen recalcitrant wounds, which are sometimes as old as 6 months and non-healing, with standard methods. When you treat them with living amnion that contains a plethora of placental mesenchymal stem cells, which are also very young stem cells, being as they do come from placenta, I've seen them take these wounds that were non-healing and then bring about remarkable healing.
Yeah. So that's interesting. Now, we know that mesenchymal stem cells are almost omnipresent. They are in almost every vascularized organ in the human being. And the question here is, would you be able to create a systematic effect by introducing these cells to the whole body and maybe target several organs at once?
Well, certainly, but delivering the stem cells and being certain that they actually reach those organs and exert their effects is the challenge. Not only that, but stem cells put into the circulation, for example, that's not their natural environment. And so it's been demonstrated that stem cells either disappear or degrade when they're introduced into the circulation within 24 to 48 hours.
So stem cells like mesenchymal stem cells would not survive within the circulatory system, within the blood vessels, and they will deteriorate after a while.
Right.
But at the same time, we've seen reports of applying these stem cells and some patients getting benefit out of those. There are currently about 1,000 clinical tests that have been done or undergoing right now with mesenchymal stem cells. So how can we explain the beneficial effect despite the demise of these cells within the circulatory system?
Well, the hypothesis is that even though the stem cells that are introduced into the circulatory system may degrade relatively rapidly, they may persist long enough to exert an effect to recruit the endogenous stem cells that are present in the person who is being treated. That's clear when we're applying the stem cells topically using human amnion on wounds. It has been demonstrated that there's a paucity of stem cells in diabetic foot ulcers for whatever reason. After you apply the amnion with several applications, although the stem cells and the amnion likely don't last more than several days, you can biopsy the tissue at a later date and demonstrate that in the very same ulcer there's a significant increase in endogenous stem cells after the application.
Yeah, so we expect that these cells that were introduced to secrete certain factors, maybe including exosomes, that might have an effect that is longer lasting and more resilient, I guess. So there is a serious problem regarding how to deliver stem cell systematically, how to create a systematic effect of stem cells introduced via the circulatory system that makes sure that they are widely distributed within the body. So I think it's a great theme to go back at next time in our discussion.
Yes.
So thank you very much, Dr. Roger. I'm sure we're going to see you again.
It was a pleasure, Dr. Rahmo.